A growing problem among veterans is obstructive sleep apnea. According to recent government data, veterans' claims for sleep apnea have spiked nearly 150% since 2009. Veterans with sleep apnea are considered by the Department of Veterans Affairs to be 50% disabled if they need a continuous positive airway pressure machine, CPAP, to get a good night's sleep. According to the National Institutes of Health, about half of Americans who suffer from sleep apnea are overweight, and aging is also a contributing factor. The specialist at Lake, Ear, Nose, Throat, and Facial Plastic Surgery explains sleep apnea and how, if untreated, it can lead to serious health problems.
Some patients are aware that they have very disruptive sleep. They wake up very tired, they're sleepy during the day, they're relying on a lot of caffeine or energy drinks. And particularly if they're overweight and have high blood pressure, cholesterol problems, they've already had heart issues, it can be life-threatening.
The long-term implications of sleep apnea is when you're sleeping, your heart has to do a certain amount of work. If the heart is under too much stress because the body is not giving it enough oxygen, there have been a lot of heart-related disorders that have been linked with sleep apnea. High blood pressure, early heart attacks, and strokes. Traditionally, people who have had sleep apnea have been treated with a special type of mask called a CPAP mask. And what the CPAP mask does is it directs pressure through the areas of obstruction wherever they may be located. The surgical treatment of sleep apnea originally was designed at the level of the roof of the mouth called the palate. And the palate was thought to move against the back wall of the throat, creating a collapse. Unfortunately, that operation, while it's still done, didn't really offer us the success rate that we were really looking for. We've come to find out that a lot of patients have problems at the level of the tongue, in the back of the tongue, specifically when they're laying on their back. Many people have worse sleep apnea when they're laying on their back than when they lay on their side or lay on the stomach. And it's thought that the back of the tongue moves backwards against the back wall of the throat, creating problems with obstruction in that area. A newer procedure called a tongue-based suspension basically places a hammock suture around the back of the tongue and allows us to suspend that suture to the inside of the front of the jawbone through a small incision underneath the jawbone. And the results that we've seen over the past 3 to 4 years with that procedure are very promising and very exciting. The good thing about that procedure is that it's less invasive, doesn't alter the anatomy quite as much as some of the other surgical procedures, and patients do very well with it.
For appointments and information about Lake, Ear, Nose, Throat, and Facial Plastic Surgery, its services, and its team of specialists, click the Sleep Apnea Story link on our homepage, yourhometownhealth.com.